Welcome back this morning on Your Health. We are marking National Infertility Awareness Week. 1 in 6 couples worldwide faces infertility issues, but there is hope for those who are trying, and a lot that you need to know. Dr. Rekha Kumar is an endocrinologist at New York Presbyterian Weill Cornell Medical Center. Dr. Kumar, good morning to see you. Good to see you. Good morning.
Good morning.
So let's talk about this. I mean, the first thing is a lot of folks wonder, how long should we try? How long should it take to get pregnant?
So it depends on how old you are and how healthy you are. If somebody is under 35 and healthy, we would say to give it 12 months of trying. If it's been 12 months and nothing's happening, that's when to seek out medical help. If somebody's between 35 and 40, 6 months. And if somebody is over 40 and they've really tried it all and they're not getting pregnant, then it's fair to seek medical attention. A
lot of women you get mixed messages about whether lifestyle or certain, things they're eating or drinking affects their ability to conceive. What would you say to that?
So to a certain degree, that's true, because it's not just about the ovary and the function of the ovary. It's the environment the ovary is living in. So we want the ovary to live in a healthy body, meaning healthy blood sugar, healthy blood pressure. So the environment needs to be optimal to throw out a healthy egg. And that requires a healthy lifestyle.
Okay. When you go in and you talk to a fertility doctor, they'll do kind of a workup. What should anyone expect from that?
So there's nothing to be nervous about with fertility or infertility workup. It usually involves hormone testing. That's typically just a blood test and a conversation, and factoring in that the male should be tested as well.
Yeah, I was going to ask about that, because there's, it takes 2 to tango with fertility. So how do you assess the male fertility? Do they usually come in as a couple, or is it a separate appointment?
Yeah, so they can come in as a couple, and they should both be tested at the same time, because 30% of infertility is due to what we call male factors, or genetic issues on the side of the male, or issues with semen related to motility or functionality. So they should both be tested at the same time.
Let's talk about weight loss drugs. There's this term Ozempic babies. People talking about, I went on weight loss drugs and then I became pregnant. I mean, what is the connection there, if any?
So there's definitely a connection there. Some of us that were early adopters of using GLP-1s in younger women that had PCOS or polycystic ovarian syndrome saw an early connection between prescribing GLP-1s and improved fertility outcomes. And that's related to the conversation we just had about the ovary living in a healthy environment. So people that have PCOS or type 2 diabetes in the family, the body environment isn't optimal for the ovary. And so using GLP-1s can treat insulin resistance, abnormal blood sugar, reduce inflammatory kind of body fat, and then the ovary works better. And so that's why we saw Ozempic babies or Mounjaro babies or whatever.
But to be clear, it's not, you don't take it, they're not approved for pregnancy. So the idea being you take the drugs, get yourself in a particular place from a health standpoint, and then get pregnant.
Correct, yes. To be clear, these should not be used during pregnancy. They should be stopped 2 months prior to trying to conceive or 2 months prior to an embryo transfer. But they can be used in the months leading up to get somebody to a healthier place in order to be pregnant.
And then finally, I mean, there's just such an emotional toll for all of this. What would your word of advice and encouragement be? Because, I mean, this is a roller coaster journey, and, it's great when there's a baby at the end of it, but everybody has a different result.
Yeah, so I would say that the path does not have to be the same or linear for anybody. And knowing that most of these cases of infertility actually do lead to a baby, and it is fine to seek out attention early, even if you're nervous. I tell my patients to get preconception counseling, meaning just have a conversation even before you are, trying to get pregnant. Talk about nutrition, talk about supplements. Are there medicines you're taking that aren't safe in pregnancy? Is there anything in your family like blood clots or a bleeding disorder that may impact the sticking of an embryo? So there's a lot to talk about before, and people can plan, and people do really well even when they think they have infertility.
Yeah, that's good. Nice word of encouragement to end it there. Dr. Kumar, thank you so much.
Hey, thanks for watching. And don't forget, you can catch the Today Show every morning on NBC, or take Today when you're on the go. Just follow the Today podcast on Apple Podcasts, Spotify, or wherever you listen.